here's my position on it. I've said this before. You know, these are federal issues, okay? And I didn't run for Congress in the United States Senate, and so I don't necessarily think that these are mine to deal with. But since you seem very interested in my position on the issue, this is it. This bill should be done, but it should be done in a way that is fiscally responsible. Now, I don't think my party is opposed to this bill. In fact, I think that the second vote that the House had, all of the members of the Republican members in the New Jersey congressional delegation voted yes for the second version of the bill, with the exception, I think, of Congressman Garrett. What I think the Republican members of Congress were trying to say was there has to be a responsible way to pay for this. This is going to be a theme that you're going to hear over and over again, I hope, from the Republican Congress, the Republican House, is that you're going to have to figure out ways to pay for this. So I do believe the bill should be done. I believe it's the responsible and humane thing to do to provide for the additional health care costs of these people who went to ground zero on the day of that attack and in the days and weeks and months afterwards, and that we deal with their health concerns. But we have to do it in a responsible way. There has to be a responsible way to pay for this. And they need to come in the Senate to an agreement on what that is. They seem to have come to agreement in the House, and that agreement, from my understanding this morning at least, was acceptable to all the Republican members of the House delegation, with the exception of Congressman Garrett. So, well, listen, Martin. Again, I've been working on this stuff. Okay, I'm telling you what I know. And my principle on this is that if they find a responsible and acceptable way to pay for it, it should be done. But we have to do these things in a responsible way. And that's my position on the issue.